Here is something most seniors have noticed, but very few have had properly explained. You are shorter than you used to be, not by imagination, not by poor posture on one particular day. Actually, measurably, documentably shorter. If you were measured at a doctor's appointment recently and compared it to your height in your 40s, the difference is probably between 1 and 3 centimeters. Some seniors lose 4 or 5. Most people accept this as inevitable, as simply what aging does. But here is what nobody tells you. The shrinking is not inevitable. It is largely predictable. And for many seniors, it is happening faster than it needs to, because of specific addressable reasons that nobody has explained. And here's the part that matters most. The shrinking is not just about height. It is a visible marker of what is happening to your spine, your posture, and the structures that support your entire skeleton. And what is happening to those structures has consequences for your pain levels, your breathing capacity, your swallowing function, and your fall risk that go far beyond losing an inch or two. Today, we are going to explain exactly what is causing you to shrink, which causes are natural and unavoidable, which causes are addressable, and what you can do starting today to slow the process significantly. The first cause, disc compression. Between each vertebra in your spine, there is a disc, a cushion of tough outer cartilage surrounding a gel-like center. These discs act as shock absorbers and spacers between the bones. When you are young, these discs are hydrated, full, tall. They maintain the space between each vertebra and contribute significantly to your overall height. The cumulative height of all the discs in your spine adds up to approximately 20 to 25% of your total height. As you age, these discs gradually lose water content. They become thinner, flatter. They compress under the load of your body weight and do not fully rehydrate overnight the way younger discs do. This disc compression is the primary cause of height loss in adults from their 40s onward. It is a universal process. Some compression is unavoidable, but compression accelerates with prolonged sitting, with poor hydration, with lack of physical activity, and with the load of excess body weight. All of these factors, all of them modifiable, drive faster disc compression than the basic aging process alone would produce. Drinking adequate water maintains disc hydration. Movement, walking, gentle extension exercises, helps the discs rehydrate after compression from sitting. Managing body weight reduces the compressive load on the discs throughout the day. The second cause, vertebral compression fractures. This is the cause that most seniors are never told about until one has already happened. Osteoporosis, the thinning of bone density, makes the vertebrae of the spine vulnerable to fracture under forces that healthy bone would easily withstand. These fractures often occur not from a fall or an injury, but from the ordinary load of the body's own weight over time. A vertebra with sufficiently thin bone simply collapses partially under the load placed on it. This is called a vertebral compression fracture. The dramatic loss of height, the senior who seems to have lost 3 or 4 centimeters in a short period, is often caused by one or more vertebral compression fractures. The extraordinary thing about vertebral compression fractures is that approximately 2/3 of them cause no significant pain, or they cause a period of back pain that the person assumes is a pulled muscle and that gradually resolves, while the vertebra remains permanently compressed. The person has had a fracture, lost height from it, experienced some back pain, and attributed it to something else entirely. This matters enormously because vertebral compression fractures are a sign that bone density has dropped to a level where other fractures, including hip fractures, are now significantly more likely. The bone density test that detects this before fractures occur is a DEXA scan. Ask your doctor whether you are due for one. The third cause, postural change. The spine has natural curves, a slight curve in the neck region, a curve in the thoracic mid-back region, and a curve in the lower back. These curves normally balance each other and distribute load efficiently through the spine. But with age, particularly with years of forward-leaning postures associated with desk work, smartphone use, driving, and sitting, the thoracic curve in the mid-back tends to increase. The upper back rounds forward more. The head moves further in front of the shoulders. This increased rounding, called hyperkyphosis, both reduces apparent height and places abnormal loads on the discs and vertebrae that accelerate their compression. The muscles that hold the spine upright, particularly the extensors of the mid and upper back, weaken with age and inactivity. As they weaken, they allow the spine to curve further forward. As the spine curves further forward, the muscles must work even harder to hold whatever position remains. Eventually, they cannot, and the curve increases further. This is a cycle, and it is largely preventable. Extension exercises, movements that strengthen the back extensor muscles and encourage the spine to straighten, directly address this cause of height loss. Chin tucks, shoulder blade squeezes, gentle thoracic extension over a rolled towel. These movements take 5 minutes. Done daily, they genuinely slow the postural component of height loss over years. Stand against a wall, heels touching the wall, bottom touching the wall, shoulders touching the wall. Can the back of your head also touch the wall without straining? If it cannot, without significant effort, your thoracic curve has already increased beyond neutral, and that is the postural direction you are currently heading in without intervention. The fourth cause, muscle loss in the supporting structures. The muscles of the core, the deep abdominal muscles, the pelvic floor, and the deep spinal muscles provide the dynamic support that keeps the spine in its optimal position under load. As these muscles weaken with age and inactivity, the spine receives less support, it compresses more readily, it curves more easily, and height is lost faster than it would be with a strong supporting muscular system. Core strengthening, the seated exercises, the wall exercises, the balance work we have discussed across this channel, directly maintains the muscular system that supports spinal height. This is another reason why the sit-to-stand exercise is so valuable. It strengthens not just the legs, but the entire muscular chain that supports upright posture and spinal height. What to do starting today? Drink more water. Your discs are largely water, and they rehydrate when you give them the material to do so. Move regularly. Prolonged sitting compresses the discs continuously. Getting up and moving every hour gives them the opportunity to rehydrate. Do extension exercises for 5 minutes every morning. Chin tucks, shoulder blade squeezes, gentle thoracic extension. These directly counteract the postural changes driving height loss. Strengthen your core 3 times a week, 5 exercises, 20 minutes. The muscular support system your spine depends on. Ask your doctor whether your bone density has been assessed recently. If you are a woman over 65 or a man over 70, a DEXA scan to assess fracture risk should be part of your routine health monitoring. And check your calcium and vitamin D status, not to take maximum doses of both, but to ensure the nutritional foundation for bone maintenance is in place. You will not grow back the height you have already lost, the disc compression that has already occurred, the vertebral changes that are established. Those are not reversible, but the rate at which you lose further height over the next decade is significantly influenced by what you do now. The choices available to you today are genuinely meaningful. Stand tall while you still can.